Hi everyone, today we are placing some PDO lifting threads. Here I am using lidocaine with epi for my insertion site. I like using epinephrine for my insertion site just because it helps control bleeding a little bit, it vasoconstricts. So as you can see by that white blanching that is occurring, that is just the vasoconstriction. So it just helps kind of control the bleeding at that site and makes it a little bit easier to go ahead and place your threads. So here I have an 18 gauge needle just to introduce, so I'm able to easily put in my cannula. In my syringe, I have lidocaine 1% along with some sodium bicarbonate just to help with the stinging that occurs from lidocaine. It can just help with comfort a little bit as we go ahead and numb our tracks. There are multiple different ways you can use for anesthetic. It's kind of just provider preference. I do like going in and pre-tunneling with my cannula, but it's not necessary. With a cannula, you can go back and forth and fall into that correct plane, but when you come in with your thread, it is a little bit more difficult to back up. So I do like to just pre-tunnel. It makes my treatment just go a lot smoother in my opinion, but it is not necessary to pre-tunnel. You can just do some blebs of lidocaine at your insertion and at the ends, just kind of up to you. But here I'm just going in with my cannula. This is a 75 millimeter cannula, and I'm going all the way down my vectors, and just as I come out, just placing a little bit of lidocaine. This patient has had lifting threads multiple times, so she is very familiar with this treatment. She is very comfortable, as you can see. So I only do a little bit of a splash just for a little bit of comfort. You don't want those tracks to be too filled with fluid, otherwise your thread will have a difficult time engaging if it's floating around in fluid. So just a little bit, as long as my patient's comfortable, I am happy. Mostly I am just doing this to pre-tunnel and get a nice idea about where I'm going to be placing my threads. As you can see, I have 4 markings here. Now I'm going in with my threads. When we're going ahead and teaching these courses, in a level 1 course, we teach a 3 vector lift. That is the very basics of lifting threads. You can do as many threads as you want, truly. My only suggestion is to not place more than 4 threads per pilot hole that you have, just because it just becomes difficult to fit your cannula into your insertion site. So if I am doing more than 4, I do go ahead and make a second pilot hole, and I just do that according to where I am seeing the best lift. I used a shorter thread for my nasolabial fold vector, and now I'm going in with an 18 gauge 100 millimeter thread for my second, just to go all the way down to that marionette area, really pushing and pulling that skin over the top of my thread as I go ahead and retract out. I'm going to follow that same process through all of my other vectors. This patient achieved a beautiful lift. I was very happy with her results. Like I said, she has been lifted before. She loves this treatment. It really just has helped snatch her jawline over time. She's great. She's gotten great collagen stimulation from this treatment. We've also done some sculpt drug treatments as well in between. So overall, this patient has really achieved some significant lift. But here I'm just placing my jowl thread. Again, I am following that same exact procedure that I did for my previous, making sure that I'm really lifting and placing that tissue up and on top of that thread. And you can already see and appreciate that lift. You can see my jawline marking. It's a little bit wiped off, but you can see how now it's a bit curved because we've lifted up that tissue. So now I'm going in with my last thread here. This one is also just going down to that marionette area. That is the area that concerns this patient the most. So we're just going in with an extra thread just to this area to provide some extra support. Using my smart hand always as I'm working my way down, making sure I like my placement and my depth. Once you have a superficial thread, you want to make sure you're correcting that during the treatment. Dealing with a superficial thread is definitely difficult. There's no breaking this thread down, and it's very, very difficult to remove. Heat application can help it break down a little bit quicker, but really you are waiting. And it's a waiting game for that thread to start breaking down. So it's really important if you see any lumps or bumps or, just anything abnormal as you're placing these threads, that you're going ahead and taking it out at that moment and not leaving that in there, because once those barbs are engaged, they're staying there. So here we're just cutting and removing our threads. You can see as I kind of do that final wipe that I just popped all of those barbs into place, and here you can just really appreciate that lift. We get a little side by side here, and you can just kind of appreciate that lower half of her face has really been lifted.